Hi friends, welcome to Diagnox. This is a panoramic reconstructed image of a cone beam CT scan which is taken using 8 into 10 centimeter FOV. So this is taken to assess the bilateral posterior edentulous areas for implant planning. You can see the patient is missing 16, 17, 25, 26, 27. So we would just assess the quality and quantity of bone, and we would also assess whether there is enough bone inferior to the maxillary sinus for placement of conventional implants. Let us move on to other slices and assess the bone. So now we will move on to the multiplanar slices. This is the panoramic reconstructed slice, this is the axial slice. We have few cross sectional areas. The red line which is marked in the panoramic image is this particular slice. So we are at a distance more than 1.5 mm from the adjacent teeth. What we should know is there should be a safe distance of 1.5 mm from the adjacent teeth towards the external surface of implant. So now we would measure the available bone width in this particular area. So we have a bone width of 6.5 mm from the crest, 8.7 mm from the mid portion. You have a bone height of 17.5 mm from the floor of maxillary sinus and from the floor of nasal cavity. So we would do a virtual planning. We would select an implant of around 4 mm in diameter and 12 mm in width. We would just place the virtual implant and we would assess this particular area. You can see that the virtual implant is in position and we have enough bone on the palatal aspect as well as on the buccal aspect. So the implant is centered within both the cortex and we have a safe distance as well. So this is the planned implant in 2.5 region. We would move on to 2.6 region and we would see that available bone in 2.6 region. So this slice corresponds to 2.6 region and we would measure the available bone width first. So now you see we have a bone width of around 8.5, 8.7 millimeter. You have an available bone height of around 6 mm. So this particular site has got very limited bone height. So this particular site would require a wide diameter implant and a very short implant. This site may require a bit of sinus lift procedure and may require a bit of grafting. So we would move on to the panoramic slice and we are just visualizing the virtually positioned 2.5. So stay tuned to Diagnox for many more interesting videos on implant planning, on pathologies, etc. If you have not liked our YouTube channel, kindly like and subscribe our YouTube channel. Thank you.